Thanks everyone for sticking around and coming back for our second panel on health. We have three great speakers for you. We have Sylvana Côté, full professor at the School of Public Health at the University of Montreal and a researcher at Saint-Justine Hospital. She is a Tier 1 CRC on preventing psychosocial maladjustment in children and youth and is a fellow of the Royal Society of Canada. And she heads up the Observatory for Children's Education and Health, the research group on children's psychosocial maladjustment, and she's received national and international awards and honors, including Senior Fellowship from the Quebec Research Fund, Research Chair in the Netherlands and France, and a Marie Curie International Fellowship. And she's won the ACFAS Award for the Quebec-France cooperation. Next up, we have Duncan, assistant professor in the Department of Psychiatry and Behavioral Neuroscience at McMaster, and a core faculty member of the Offord Center for Child Studies. Laura is an early career investigator with a research program in child and youth psychiatric epidemiology, measurement and assessment of child-youth mental health, and the design implementation of population health approaches to evaluate child and youth mental health services. And last but certainly not least, Kim McGrail, Scientific Advisor for Population Data BC and the Scientific Director and CEO of HDRN, Health Data Research Network Canada. Her research interests are quantitative policy evaluation and all aspects of population data science. And I thank all three of our speakers for joining us for this panel. But before you get to hear from them, you have to hear from me again on the current state of Canadian data health, just so we're all coming in on the ground floor. So key data sources and national health databases. So you'll have heard a little bit from Ted's presentation that we have this thing called CIHI, the Canadian Institute for Health Information, which collects data from the provinces and makes it available in various ways. They have aggregated data reports. They have microdata that they provide to institutes like Data NB or to the RDC network. We have health surveys. We have the Canadian Community Health Survey. That's one of the longest running cross-sectional surveys in Canada. It's been going for like 25, 26 years now. We've got the Canadian Health Measures Survey. I'm not going to talk about the Ontario Child Health Survey because Laura's here to do that. We've got the Canadian Longitudinal Study on Aging and many more. A lot of researcher collected data, a lot of experimental data collected in this area of research from health practitioners and people doing sort of health research. We've also got electronic medical records, patient charts, diagnostics. Those are like imagings and labs, pharmaceutical data on health insurance, supplemental health insurance. So there's a lot of different data sources that touch on health. And a common theme you'll hear is a lot of these things are siloed. As far as the institutions that are doing some of this stuff, you've got Statistics Canada, which does the national surveys and the linkage to some of the CIHI records. You've got the provincial and territorial bodies. So we've kind of created these, each province has its own created, health data system. In Ontario here, we have ICES, the Institute for Clinical and Evaluative Science. In Manitoba, they've got Manitoba Center for Health Policy, Alberta Health Services, Pop Data BC, where Kim's from. So every province kind of has their own silo that they've built. There's provider networks. So the Canadian Center for Addiction and Mental Health has data, of course, about providing, and they're also a research institute, so they collect data for research purposes. You've got the UHN here in Toronto. You've got the Vancouver General Hospital Network. You've got the CHIM, where Sylvana's from, the Centre Hospitalier, Université de Montréal. And then regional, you've got provincial health units. They're collecting data on vaccination status and things like that. You've got regional health authorities. You've got the regional health survey that Dr. Frank spoke to us about at FNIGC that they sort of coordinate with the First Nations. So there's lots of different data collections, lots of different people collecting data. And again, we're going to hear some of the challenges and some of the opportunities that this gives from our distinguished panel. And without further ado, I'm going to bring Kim and Sylvana up on screen to the extent that I can. Stop share. And we're going to start with Sylvana Côté.
Okay, good morning. Is my presentation on presenter mode now?
You see your presentation, but I don't have a video panel, so just give me 1 second to see if I can find that. Oh, show. I'm glad you're here. Sorry, show who? Okay, I'm just going to give it to you. Ah, there you are. Wonderful. Okay, please go ahead.
Thank you. So I think I'm the representative of Quebec today. So the first thing I would like to say is that I apologize for our not contributing to health data. If it was only up to me, I for sure would have Quebec in there. But I hope one day, not too far away, that we can contribute to health data and thus compare across provinces our healthcare services. What I would like to do today is to situate my talk within a substantive issue, which is my research area, children's development. I would like to take children's development as an example of why we need a population-based full coverage data to improve the services that we offer to our future labor force worker, our children. So why do we need population-based pan-Canadian data to improve children's education and health? I have two slides that are really about the substance of children's development. I want to make the points before I go on to talk about data. These are brain charts for the human lifespan. They were published in Nature in 2023. And what you see here on the x-axis is age from preconception, so prior to birth, to age, let me see, 100 years. Do you see my pointer? Do you see my mouse?
You do.
You do? Okay. So what we have here are data from 130,000 individuals pulled together across more than 100 studies, because imaging studies of the brain are very difficult, costly, and heavy to do. And so many researchers got together to put together these charts. I'm sorry. Okay. And so you see the extent to which the structure of the brains, not the neural network, but the structure of the brain is developing at a rapid pace between preconception, and the red line is age 5. Most of brain development in terms of the white matter, the gray matter, etc., is developing prior to age 5. And the only thing that is growing as we age are ventricular volume, which is really the holes that we have in our brains. So this period is truly important. This is brain development, but physical development is following similar curves. And we know very, very, very little about children's development prior to age 5. This slide is based on real data from Quebec. And so I had economists calculated the cumulative share of public spending over the lifespan of Quebec citizens. And what we see, of course, is that public spending is small prior to age 5. It's less than 10% of public spending, while we have approximately 90% of brain development. So this mismatch is, according to some, an issue. And of course, children are not needing many health services when they're younger, but they do need education in a broad sense. And some are really under the radar of our education intentions or efforts. So why access to administrative data matters for research? So I appreciated the point made by my colleagues earlier that administrative data is not made for research, so we have to work around that. I come from a background where I've been collecting data my entire career, which is 30 years now, spending huge amount of time, human resources, and money in collecting data, and coming to the conclusion about 10 years ago that I have to do something else than collecting data on children's development, because I cannot study children and families who have the most serious complex problems and those who need services the most by doing data collection myself with my teams. And so I appreciate tremendously the longitudinal data that my colleagues and I have been building over the years. But in the end, we study people who can participate in those research, and they're always doing relatively well. So for those wanting to study and understand the most difficult problems, administrative data is offering a window into a different window than research data, which is needed. Researchers' expertise can be used to analyze administrative data, which is I think researchers are an underused human capacity to inform decisions. And I appreciate also my colleague from Ontario. I wish we had many people like you in Quebec who say that we can work around some issues, but that there is resistance also on the ministries, government sides to work with researchers. So we've been building database, which I was told in BC you have such a database for a long time, but in Quebec it's something very new. It was a vision a few years ago, a dream that some of us would not dare to say out loud that this was a wish, but a wish to build a data set that would include all children in Quebec, growing up in Quebec, not only born in Quebec, but growing up in Quebec, linked on administrative data for health, psychosocial services, and education. And now we're working on linkage with fiscal data for the parents, once we've decided who are the parents. So this is a little bit of a dream come true, but of course it comes with many reality checks when trying to use this data. It is highly secured, and I hope that we can make some headway, perhaps together, on providing more agility in using administrative data in this country. What we need, I think, to move forward, my thoughts are really high level on this. I concur with what was said earlier. We need to show usefulness. I don't think that people understand, the public, the decision makers, that the use of administrative data can be useful for decisions, that it can really improve the health of the citizens. We need to make a case, a strong case. It is not clear to many people, including some researchers. And so one-time consent, I was asked this question, what should we do about consent? So a one-time consent with risk proportionate governance, to me, is not impossible. I mean, a one-time consent to data that is high-level aggregated, that can be provided via the FAIR principles should be something that we can aim for. Of course, when you get to fiscal data, micro data, family data, psychosocial service data, then there needs to be layers to access and consent and security. But for high-level data, a one-time consent or no consent should be feasible. Common data linkage with a common ID. A common ID. I mean, the countries who do a good job, they have one ID. You know, the Scandinavian countries are always those we come back to, but it really works. It really works. And of course, federated secure by design environments. So these are my thoughts about access to data for children. Thank you.
Thank you. Let me give you this.
And this guy.
What is it? I often turn it off.
I can just use that. Does it work? Yep. Yes. Okay, perfect. Great. Thank you. Nice to see everybody. It's always interesting being back in a room full of RDC users. I started using the RDC 20 years ago, did my sociology degree with Bob Anderson using the GSS, and now it's like back in a room full of people talking RDC things. It just feels like family, and you're like, I know these words, I understand these challenges. So it's kind of nice to hear that. For a bit of context, I've moved from using population health data into more local and provincial initiatives around building robust information systems and measurement instruments for collecting health data, particularly around child and youth mental health. So I'm actually an embedded researcher in McMaster Children's Hospital, where I'm trying to help them better collect and use data with the idea that then it can inform provincial level indicators, and then that would feed up to something higher. So we're kind of going from the ground level up. So I've kind of gone in reverse from population kind of down to local level. So I'm going to tell you a story about child and youth mental health data in Ontario, the challenges that we face, and some of the initiatives coming out of the Offord Centre for Child Studies to address those challenges. And these include policy, advocacy, research efforts. So you'll see that we've really tried to tackle all different types of approaches. So according to the most recent Office of the Auditor General's report on child and youth mental health from 2018, they reported that agencies do not monitor and assess outcomes to determine if clients benefited from the services they received. The ministry does not fund agencies based on the needs of children and youth served. I mean, that to me just blows my mind. We don't even know how many unique children go and get services in Ontario, which also is mind-boggling. But the fact that we do not fund services based on need. Publicly reported performance indicators on wait times and child and youth mental health outcomes are misleading. So all of this is up to say the least. No. Okay, thank you. So in my own work to evaluate the child and youth mental health service response, we linked general population survey data from the Ontario Child Health Study to expenditures data from the Ministry of Children and Youth Services to analyse service area level variations in unmet need and resource allocations. So the service areas and regions in child and youth mental health are organised as shown on this map here. And if you look at the top graph there, what we're showing is area level variation in unmet mental health need, with service areas ranging from below average on the left to above average on the right. And so Toronto is in there somewhere, but it includes all the service areas across Ontario. We found that rural areas, areas with poor public transportation and higher levels of socioeconomic disadvantage had higher unmet mental health need. So the bottom graph shows regional service expenditures to child and youth mental health. So what you're seeing there is significant area level variation in per capita expenditures on child and youth mental health services. And again, we're not seeing that expenditures were allocated according to need, at least based on our definition. And can anyone see? So, okay, we've got Toronto here is quite high. But if we look at this, which is actual expenditures, these other bars are based on need. So Toronto actually has a higher bar compared to more money compared to lower levels of need. And then if you look, for example, in Central Ontario, we have lower levels of funding, but actual amounts of expenditures based on need are higher. So Toronto, there is a bit of an effect of Toronto just getting more money because it's the big city and everyone loves Toronto. We're not bitter at McMaster. So the challenge we have then is in child and youth mental health, and speaking to Ontario, is that poor data quality and coverage on child and youth mental health need and service outcomes leaves governments unable to determine service effectiveness or measure the impact of policy or investment decisions intended to improve child and youth mental health. So if we think about during the pandemic, we kept hearing, oh, we need to improve child and youth mental health. We need to increase availability, accessibility of services. Great. Make some decisions, but we have no way of knowing if those policies worked without building some kind of information system or data structure that would allow us to do that. So what can we do then? So I'm going to outline some initiatives coming out of the Offutt Centre for Child Studies. And like social media, this is very much a highlight reel. So I'm not showing you all the challenges and nightmares and headaches behind the scenes. I'm showing you that, oh, look at us, we're so great. But I'm hoping we can get into some of those challenges during the discussion, because I think that's where the fun stuff is. So first of all, there's been a lot of advocacy work led by our director, Dr. Stelios Georgiadis. He was able to make recommendations to the Standing Committee on Child Health. And then this was published in the Study on Children's Health, which resulted in commitments from the Standing Committee to develop a national pediatric health data strategy. So this is, you know, a government commitment being made. They want to facilitate the collecting and sharing of high quality longitudinal disaggregated data on children's health indicators. I mean, this is only a commitment, but it felt like a significant step in the right direction. Second, Offutt is home to a lot of unique, one-of-a-kind kind of research studies that can provide critical data and evidence on child and youth mental health. So one of these is the Ontario Child Health Study. It was first conducted in 1983 and then again in 2014, led by Drs. Michael Boyle and Kathy Georgiadis at Offutt Centre. The study was conducted by CIHR, or funded by CIHR. We also had to get funding from the Ontario Ministries of Health, Education and Children and Youth Services, because when CIHR did their across-the-board cut, the StatsCan bill came in and we were like, well, we can't afford that. So then we had to go to the ministries and ask them to fill the gap. It was conducted in collaboration with Statistics Canada and designed to give a complete picture of mental health of children and youth, and to help Ontario make funding decisions about families, schools and neighbourhoods. So this study is so unique. It was a survey of 180 neighborhoods, 6,500 homes with 10,800 children. It was a multi-level study, and we surveyed up to 4 children in the home, the primary caregiver, their spouse or partner, their teacher. I also joke that the dog may have been in there. And then we also linked it to health and education administrative data. And then there was a parallel survey called the School Mental Health Surveys, which went into the schools that these kids attended and surveyed principals, teachers, and students in each of those schools to be able to access school climate. I mean, this thing is mind-blowing. Following the study, it went into the RDC. We conducted the linkage with education and the Ministry of Health. And then interestingly, there is no one place that all the data sits because of the weird rules around linkage and how things had to be done. Some of it lives in the RDC, some of it lives outside the RDC, and never the twain shall meet. So you can't actually look at the education and health data together, which is a bit bizarre. There were significant challenges with funding, as I mentioned. We've got the same problem in that there hasn't been that much data use of this unique data set. I keep hearing that over again. It's like, as academics, we want all the data, all the time, all the things, all the linkages, but then do they actually get used? And this survey is almost 10 years old. So it is 10 years old. It's hard to encourage people to use it. So one of the findings that came out of the 2014 Ontario Child Health Study was that putting together and funding these kinds of massive studies at millions of dollars every 30 years is just not feasible. And it's just not that useful when it comes from a policy perspective. So we need to build better and more dexterous ways of monitoring child and youth mental health in particular. So a possible approach was laid out in this policy paper that was part of a special issue on the Ontario Child Health Study. It was in the Canadian Journal of Psychiatry. We had a bunch of substantive quantitative papers, and then we had 2 policy-facing papers. So one was around tracking children's mental health in the 21st century, and the other one was around understanding trajectories of mental health kind of over time. So what this paper really talks about is the limited information that we have recorded on children's mental health in a standardized, systematic way. Mental health doesn't really sit in health the same way that children's cancer and things like that do. We also have issues with the alignment of core children's mental health measures. There isn't great alignment. We've tried to do some harmonization. We don't have a ton of robust measures. For example, children's functioning. We haven't got good agreement on how best to measure that. And then it outlines the content, the prerequisites, and organization of a children's mental health information system. So these ideas are what my research program is built on. So in my work, I'm trying to develop and evaluate what I'm calling kind of informatics. So there are things around measurement instruments, information systems, and digital technology that can make data usable at the local level, but also rolling up to provincial. I mean, I've got my work cut out for me, but it's very exciting. But really the idea is to create infrastructure and processes to track mental health need over time and place, and provide data that can help us to quantify, plan, and evaluate services in an efficient and effective way. And again, as I said, we're trying to kind of proof of concept at the local level, and then can we roll up? So ultimately, this research aims to build a system for collecting and using data for understanding the distribution of child and youth mental health need, telling us whether services help. This just seems like a critical thing that we need to know. And then beyond that, kind of rational planning, can we organize services to improve mental health and lives of children, youth, and families in Canada? So yes, that's all from me.
Okay, well, thank you very much. Yeah. Oh. That's spotlight. Spotlight. All right, Kim, the floor is yours.
Great. Thank you. And thanks for the opportunity to be with you today. So I'm going to spend just a few minutes talking about solving some of the challenges in multi-regional health research, some of which you've heard from the previous speakers, and I assume from the previous panel as well. I just want to say I don't have any conflicts to declare, and I do want to acknowledge Simon Fraser University is my academic home, and CIHR is provided funding for Health Data Research Network Canada. So this is briefly what I want to cover in the next little bit of time. Just a short background on Health Data Research Network Canada, some of the origins of the challenges we face in doing multi-regional research, and then a few words on comparability of data and the fact that there's no movement of data. So those are the challenges that we're trying to solve, among many others, but those are the focus of my comments today. So Health Data Research Network Canada, or HDRN Canada, we are a pan-Canadian distributed network that was funded by CIHR under the Strategy for Patient-Oriented Research umbrella to support and make more possible multi-regional data access and use. So this is kind of taking this understanding that there's lots that we can do in the research world using provincial, territorial, and pan-Canadian data, but there's a lot of things that are potentially like feasible, but practically impossible to do right now. And that's what we were set up to try to address. And we want to make sure that there's a future where the use of data supports health and health equity. That's kind of our main mandate there. This is a sense of the organizations that are involved with HDRN Canada. This is just to share that it really is pan-Canadian. We have member organizations from every province, 2 of the territories. We're still working on bringing in Nunavut, and then 2 pan-Canadian organizations, the Canadian Institute for Health Information and Statistics Canada. We take when we're supporting data access, we have a no wrong door approach. So if there was something that somebody could do that needed just StatCan data, we'd send them over to CRDCN. If there was something that CIHI's data holdings could support, we'd send them there, and otherwise we try to support them through the data network, which includes the data centers that Grant mentioned in his opening remarks, among others. The other thing I would note is that we have a data asset inventory that's openly available to people to have a look at, and it includes just about 600 different data sets. And of those, only about 200 are available through CIHI or StatCan or CRDCN. So there really is a lot left on the table if we don't have something like Health Data Research Network Canada kind of as an intermediary to support researcher access to data. And just on some of Sylvana's comments, there is participation from Quebec in this network, and there have been projects supported through that participation at this point. Okay, so I just have to, when I teach on this, I always talk about why is this so hard in Canada? Why is it this way? And I know that everybody in the room here probably understands all of this, but we do have a constitutional federation. So health and social services are the responsibility largely of provinces and territories. And this means for the data that we're talking about, whether it's health specific in the healthcare system or the health related data that might be more about social and structural determinants of health and other things, they're just really different across the country. We have different legislation. The privacy legislation is very similar. The interpretation of privacy legislation obviously varies as much within provinces and territories as it does across. But we have really different policies that underline the delivery of these services. So there's different coverage, different population groups have different access to different things. Those are different across provinces and of course vary within provinces over time. We have different technology collecting data. There's different classification standards, different choices about what to include in data sets. So with the exception of a few pan-Canadian data sets that are handled by our pan-Canadian national organizations, there's just a lot of difference, a lot of noise in the system, and a lot of challenge in pulling data together and making them comparable so that research can be done. I just always add the politics part in there too, because I think that has something to do with data access and data sharing, but we'll leave that in case, unless somebody wants to raise that during discussion period. So lots of studies, as I've already said, are theoretically possible, but practically infeasible to do. And I think I've really covered most of what's on here already. But the apples to apples comparison, making data actually comparable, ready to be analyzed, is one step. And then the dealing with the fact that we're not generally allowed to move data across provincial territorial boundaries is another. And I want to, on the last point, I just want to say that I actually think this is probably a good way to think about the future, is that data will stay where they are, and we need to think about taking analysis to data rather than the other way around. So there's lots of reasons for this. Some of them have to do with legislation, but some of them have to do with actually enacting some of the principles of data sovereignty that we've made commitments to. So this is a way to bring Indigenous organizations into the picture to respect the provincial territorial sovereignty, but also to think about Canada. I'm from the States originally, so I feel like I can say something a little more on this. I'm just thinking about attaching Canada more directly to the EU, and all the work that the European Union is doing in their health data spaces is something that we can learn from, because that they are organizing things to work seamlessly across the countries of the EU. If we can do the same or similar things in Canada, then we're going to be poised for international research as well. So this is my favorite depiction of how Canada can be part of the EU. Okay, so how do we solve the challenges here? So just a few definitions. I'm happy to share the slides. I'm not going to go through every single bit of these definitions, but this is just meant to show that if, when we're getting data ready to be analyzed, even if we were able to pool data together, we absolutely have to go through these steps of harmonizing them and making them truly comparable in preparation for analysis. So if you think about how are we going to do that, you'd have an information model in your head, and it's just conceptual, but we know the kinds of variables we want to include in our data set. So hospitalization, or something on child mental health, or something on early education, that sort of thing. And then, so that's an information model. And then a data model is the more concrete instantiation of an information model. It's established as how the elements stored in a system. And so this is the more like the physical thing that we might be working with. And then a common data model is just a data model that lots of researchers have agreed is something that we should actually just keep going over time. So it's replicable, or it stands across different organizations, but it's set up in a way that it's going to support lots of different kinds of research, and therefore it needs to be something that's ongoing. And then moving on to how we work with either a data model or a common data model, distributed analysis is where we have the same kind of, at least conceptual setup in different provinces, and then we can analyze those data separately. And then a subset of distributed analysis is federated analysis, where we actually technically connect different systems together to enable high quality and seamless analysis of data that has a single common data set that happens to be partitioned into different places across the country. So the first part of this then is setting up either the data model or a common data model, if you want to go down that route. So, and just to acknowledge that this takes a lot of really deep knowledge locally about data, policy changes, the data generation, all of its idiosyncrasies. And it really requires, once we do this kind of mapping to harmonize things across jurisdictions, it really requires a lot of good documentation so other people can interpret what's been done and decide for themselves whether that's appropriate to their study or not. It does take a lot of time to do this kind of harmonization, but it only needs to be done once. If we do it once, we can use it lots and lots of times. So it's an upfront investment that has a huge payoff on the back end. And this is like, if you think about the world, in the future world of interoperability among electronic medical record data systems, which would be the ideal, at least within the health sector, this was like a precursor to that. This can be set up to be then seamless integration once we have that prospective interoperability. And then on the federated analysis side of things, it is the best of specifically the federated, if we can technically connect and make this all sort of happen without a lot of user intervention, then that is going to be the way of the future. Statistically, we know that it's very possible to do lots of these kinds of analysis really robustly. You get as if pooled results down to the second or third decimal point. There's probably still some kinds of things that will be trickier to do in a federated environment, but lots of methods development that can be done to help move that, even the sort of frontier of possibilities along. We know that this can be done in a privacy sensitive way. There are things that need to be shared when you're doing federated analysis. Covariance matrices, all sorts of, it depends on the technique you're using, but that kind of sharing can be done in a very privacy sensitive way that has been shown. And then, as I said, the federation automates the sharing of that information. And again, this just makes this really possible for us to think about doing international research if we get this right. Now, if we put these things together, really one of the major advantages of doing a common data model, or even just a data model, even if it's not one that is longstanding, once you have a data model in place, your analytic code will work. You can set up everything so you have the same sort of data model, the same setup, the same semantic structure in 5 different provinces. Then once you develop your analytic code, you will know that it will work in each of those 5 provinces. So we've just decreased massively the amount of time that actually takes to run analyses once the data are set up. And then, as I've said, you do get good results if you do this. So that this we see this kind of change in having data models, harmonized data, things that can be available to researchers just to request that we already know are comparable across provinces will be a step change, probably an order of magnitude in the speed and efficiency of our ability to do this kind of research. So we have a federation, we have commitments to Indigenous data sovereignty in Canada. We have to just structure our processes to reflect that reality. It does create surmountable challenges, and specifically for data that aren't available through CRDCN or CIHI. The harmonized data and common data models does take upfront investment. That's the thing that we need to focus on, as well as the investment in the actual physical infrastructure that will enable federation in a safe way, ideally on not on commercial cloud platforms that are from the US, but on something that's homegrown, hopefully supported the Digital Research Alliance of Canada. Distributed analysis is going to be the way of the future, and we know that it's feasible in developing resources for this. And this just creates so much more opportunity for the kinds of things we can do, because in addition to the routinely collected data, we can add in researcher collected data where there's consent to do that. We've already linked in the longitudinal studies to the administrative data, and all sorts of other possibilities are coming. So that's it for me. Thank you very much.
Okay, thank you, Kim. Just gonna also spotlight Sylvana. So spotlight, and then spotlight, and spotlight. Okay, do you have a chat? Is there a question already? Okay, so over to our audience to save our presenters from me. Do we have any questions in the, oh, there we go. Grab that mic there.
Can you hear me?
Yes, we do.
Okay, sorry, is it okay if I just do this instead of typing it in?
Sure.
Okay, perfect. I have a question for Kim. In the federated model, I guess I'm wondering in practice what it looks like, especially for researchers that maybe don't have a lot of resources. When you say that data stays within the boundaries, do you mean like literally that people would have to travel to each 10 provinces? No. So what's the like technical like platform that sustains this is my question.
Yeah, most of the groups that we work with, our member organizations, have data that is available in secure research environments, and those are virtual. So right now, what would happen is if you say you were doing a study in New Brunswick, Alberta, and British Columbia, you would have data sent to secure environments in those 3 provinces, and then you would be able to interact independently with each of the secure environments and do your data analysis. When you have federation, what the design that we have proposed, we have a Canada Foundation for Innovation grant under review right now. So the design we proposed is that you have like a hub and spoke. So there's one trusted environment that a researcher would interact with, and then that trusted environment has a trusted relationship one-on-one with each of the other secure environments where the data are held. So you would start analyses in the central node. That analytic process would be sent to each of the individual nodes, back to the central, and then shared out. So, and I say it that way because what we're trying to set up is not something where BC needs to trust New Brunswick, but BC just needs to trust the central node, because then that makes it really possible to think about scaling beyond that and getting into the international space. So no, nobody needs to travel. That's not what we're trying to set up here.
And sorry, is it okay? I can't see the room. Is it okay if I have a follow-up question?
Sure.
Okay. I guess I'm wondering, so this addresses kind of across jurisdictions, across like the same data set, right, across jurisdictions, but it doesn't, or maybe it does, and I just don't know how, it doesn't address, let's say I want to link federal tax records with provincial health data, right?
Yep,
Or is there
yep.
something built into this that also allows that?
Yep. So when we talk about federation, we talk about horizontal federation and vertical federation. So the horizontal is you've got the same data set on different people and that's partitioned in some way. And that's the main case we've been thinking about. So that's what I was describing. There's also vertical federation where you have got different data on the same people in different places. And that's when, say, we wanted to link between the data sets that CRDCN makes available and some of the things that we have in the provincial data holdings. We're working on a pilot with Statistics Canada right now to tackle that in a federated environment. And we're far enough along that the Statistics Canada analysts have looked at the federated approach that we're using and have determined that it is fine. It's privacy sensitive. It meets their requirements. So we're moving on to defining a pilot project so we can look at that vertical federation. So it's absolutely on the agenda. We know that this is an important thing to do. And then the challenge after that is going to be, can we combine vertical and horizontal federation into this an analysis? And I assume the answer is yes, but it's going to be like a little more complicated.
Fair enough. Thank you so much for your presentation. Really interesting.
Go ahead, Ted.
Yeah, thanks. This is for Sylvana. So more of our provinces the provincial data centers are getting education data linked with health data. So Manitoba is one, New Brunswick is one. I think Ontario is making some progress there. But what's unique so far in Quebec, and this sort of builds on Gail's comment, is your ability to link at the provincial level your tax data. And I expect that's because it's Revenue Quebec rather than the feds. Could you comment a little bit on, if you are aware, how that negotiation happened and whether there might be any lessons for dealing with Revenue Canada? Because when we are looking at kind of making a case for investment in early education, prenatal, neonatal investment, when it really matters a lot, our decision makers want to see the numbers, and to do the numbers, you need to have something on the subsequent impacts on labor markets and social assistance use and so on. Thanks.
I have so many things to say about this question. I will start with linkages. The day we linked longitudinal data collected since the 1980s with fiscal data for the first time about 10 years ago. It took 10 years to do it.
Next slide, thank you.
It took 10 years to do it, and it was with StatScan, actually. It was not at the provincial level. It was with StatScan. And this day was an epiphany, you know, because our longitudinal data, for which we had 40% attrition, suddenly became like the original sample again because of the linkages. Then in Quebec, it's happening. We're in the process of linking with education and health data. And what happened is that there was a law that was passed in 2021 approximately, where the ministries had to designate some of their data. It was a negotiation process still going on, designated their data for use for research. And basically, this is a political decision, but there's not much political opposition to that. That administrative data is designated for research, especially since it's the ISQ, Institut de la Statistique du Québec, who's managing the data, and they're doing it in a very, very secure way. So that's how it happened. So now the immigration data provincial is designated fiscal data health education gradually. Then your point about return on investment for early childhood services. So we know the Ekman curve about return on investment, those experimental studies that indicated that the earlier the invest, the better the return. But really, the data supporting these calculations are really dated. Experimental studies small. They do not reflect the state of the prevention services that we have today in a country like Canada. And so we can perhaps make the argument that we do have some return on investment, but I do not expect it to be substantial. And some of us in the child development community thinks that this should not be what's driving the decision to offer high quality education to our youngest citizens. Nevertheless, it would be great to have the numbers.
Speaking again.
Sure. About this, Kim and Sylvana, can you hear me online?
Yes.
Okay, thank you. Thanks for the wonderful panel and presentation. Kim, I just wanted to ask you a question, or maybe for a comment. I was struck by your final slide where you were, which was great in identifying that Canada does have a commitment to respecting Indigenous data sovereignty, and then you sort of continued on, and within the context for that was that it was a challenge, but a surmountable challenge. And I'm just wondering if we can, if you wouldn't mind reflecting on, imagine in a future state, and I know there's a lot of complexity here, what possibilities for that being an opportunity might be for a healthy linked data environment that served everyone in Canada.
Yeah, I mean, it's a great question, probably deserves a whole day of discussion itself. But I think the way, the sort of most foundational way that I think about this is, if we're setting up federated systems, then Indigenous nations or communities, whoever ends up being the holder of data for Indigenous communities, which might be themselves, it might be somebody they engage with, that's up to Indigenous nations and communities, but then those become nodes on a federated system. Now, that is like the easiest way to think about this, but it's of course much more complicated, because information on Indigenous people is collected in the normal course of provision of services and health and social systems. So we need, I think, first to be thinking about, what do we even mean by Indigenous data when we're talking about that? Is it just data that has an Indigenous identifier? Is it does it include 6-digit postal code, which we know in many cases could identify an Indigenous community? Does it include data sets that have an unfortunate overrepresentation of Indigenous peoples because of past colonial practices and all sorts of other things? So that's kind of a layer of conversation that really needs to happen with Indigenous people. And then, of course, I'm using the term Indigenous, but we know that there's a distinctions-based approach to this. We need to be thinking about First Nations, Métis, and Inuit. They will have different expectations and practices. So this is like part of reconciliation. This is a long process and needs a lot of work. But I think the basic fact is, if people want to share their data, then that's great. And if we can't, then the federated architecture, federated thinking will allow us to have more flexibility and let people retain control that they have as rights holders in these systems.
Thanks.
Yeah, I want to put a question to the group because it's a common thread of sort of everyone's talk is that we need really big things to happen, right? So Sylvana's building a big platform, the OCHS, big investment, big survey. And of course, the HDRN would represent a very big investment where CFI to fund you, fingers crossed. And so the question is like, how do we summon the will to get these big investments, and what do we have to do as a research community to ensure that Canada continues to make these big investments in health research? Nice, easy ones.
Can I share a thought?
Indeed.
I mean, it's not necessarily easy. It's not easy, but it's a way to think about the investments that we make in data collection and data harmonization and data use. What if, you know, we should make our data available according to FAIR principles. This is requiring a lot of work from researchers, institutions, etc. Data management plans are not many people are familiar, have the expertise to do this, and so we're all in this together. But what about if we set up something like, if you collect data which is federally funded, CIHR, SSHRC, and the study is a consequential one, une étude conséquente. I mean, it's large enough, it meets some requirements. We fund you, but we expect you to drop your data in Kim's hub, you know, or other hub of your choice, but something like that, so that the data management plan is taken care of by solid infrastructure, well governed, well thought about, and then the scientific community can have access to the data after a certain embargo, let's say. I think a model like that is not to be, I mean, it won't happen so quickly, but I think that people who collect data themselves are not aware of the potential of linking this data with admin data. And people who work with admin data are maybe not aware or not interested in the finer, more detailed level understanding that they can have with research data. And such a proposition would perhaps make people reflect on what they can gain from combining data.
I can jump in here too. I think that was a very nuanced and articulate way of saying, I think what I would just say, like, collaboration, because I think people have to work together when they're coming up with these initiatives and ideas, and that's amongst researchers themselves. But also when I think about the Ontario Child Health Study, we went out ahead of time to policymakers at the Ministry of Education, the Ministry of Health, the Ministry of Children and Youth Services at the time, and tried to get their buy-in up front for why this was going to be useful and why policymakers should care. And then we had policy folks kind of in the room when we were talking about how the data was going to be used. So yeah, my that's not as coherent as what Sylvana said, but helpful. But then the other big thing that I'm learning about is feeding data back to the people that you collect it from, because I think we do kind of gather and kind of hold these data and then say, well, researchers can see them, but what about the people whose data it is? And at least at the hospital level, I'm finding that collecting data from children and youth and families, and then actually sharing it right back to them, and then sharing it with their clinician, you then get buy-in from people. They understand why they need to fill out this stupid questionnaire at the end of services. And so I think part of that, whether you roll it up and send it back to communities or to provinces or whichever level, I'm beginning to see the value of that. But then that also requires a ton of resources and investment and effort.
Yeah, and I think what I would add is one of the things we need to do is improve the data collection and data organization from in these administrative systems, which is not, as researchers, that's not our issue, but we hope that places like Hi are talking about using AI for coding to really speed up the process by which and the timeliness of the data that are available. So if we can improve that, and then also improve data governance to make these routinely collected data and all the things that are linked to them more easily accessible, then that's going to be a big improvement, because it will make those data more attractive to some people who don't want to use them because they're a year old, and we've made lots of progress in that space, but there's lots more that we could make. Okay, so if we can put that in place, which we should, because the systems that are collecting those data need timely data as well. So this is going to be another sort of sunk cost that really absolutely should be in place. So then from a researcher perspective, I would say when you're starting to do think about a project, don't collect data unless you have to. If there's an existing resource that can answer your question, don't go collect something new. I think that we do a lot of this in Canada to our peril. If you have to collect data with broad consent and with the intent to link it, because then we can do longer term follow-up studies. We can, collect what you need to, but attach it to the things that we already can have and understand from existing systems. We need to set up technical systems that are interoperable, so that we're designing from the beginning a space that is actually an increasing full ecosystem of data that can all work together and be available together. I look to the Digital Research Alliance of Canada as something that absolutely should be the space that they're working in. And then the last thing is really collaborate. And then I know that my colleagues have said that already, but we really need, as researchers, to be thinking about ourselves as something bigger than our own projects, especially in the data space. We're all talking about data management plans and FAIR and all of those things, but we can think about that even within our project in a much, much larger way, about how what we contribute is going to make the whole even better for the next person that comes along. To me, that's the biggest thing about open science, is the ability to actually use scientific methods. We know that science itself gets better as time goes on. We understand more. The data system should be doing the same thing. We should be able to do more with more data if we do this in the right way.
Okay, so I actually have a quick follow-up, because all three of you are very close to this. Do we have the social license for broad consent, or are we going to be cutting off a portion of the population sort of systematically that is important enough that we should be thinking carefully about asking for broad consent?
I have lots, Grant, you know this, I have lots of views on this subject. And there's a whole other different topic of conversation, but we do have license for many of the things that we're doing. But if we're going to go in this, we're a data intense society. We have AI coming at us very quickly. We absolutely need to set up the structures to be able to engage people. And again, this is something I think probably is much better done. We have to do this on our individual projects, but I think we need something larger than that as well, something more systemic in place to make sure that we are engaging people and diverse people, not just the people who have time on a Friday morning to come and do these things. So that's maybe I'll just leave it there. We have to do that.
For this one, I don't know how I feel about this yet, because we were in a situation with the hospital where we were struggling with getting people to consent for being contacted about research studies, and it felt like just so annoying that we couldn't just have a general consent. And then the hospital moved to opt out, and it actually has been a nightmare. And I thought that was what I wanted, but now you've got people who are participating in multiple research studies, and you don't know that they are, and you ask them, which study are you in? They didn't keep their consent form, so then you don't know if you've got a clean control group or not. And I was like, I thought this was what I wanted. So yeah, I don't know. I'm still trying to figure that out, and that's just at a local level, but it was the whole hospital deciding on behalf of everybody. Yeah.
If I can add something, Kim, you put it perfectly to me, that this goal that we should have to reduce data collection and pull together the data that is there. We are not aware of what we can do with the data. Just listening to my colleague who has 200 data sets for labor, it's like, wow, and the data collection should be rare, it should be sparse, and I think we should also think about different ways of collecting data. We will always need fine-grained, detailed data, but there are new methodologies in data collection that allow for very broad survey of just a few key questions, well thought out, that can give researchers a picture of a problem without going through the ordeal of filling out questionnaires and long questionnaires or consenting to sharing detailed, intimate data. So there is something about developing the methodologies also for collecting data in a more efficient way in this day and age, which is it's different. We have moved forward with data collection. We should be up to speed.
Yeah, this is a comment on investment in the data ecosystem. So we know that there's piles of money going into AI by the federal government. So people may have heard of or be familiar with Administered Data Research UK. So this is a partner organization with HDRN. So I'll read just briefly. It ensures data provided by UK government bodies is accessed by researchers in a safe, secure form with minimal risk to the public. It's a partnership, but it's independent of government. They were funded £90 million in 2021 and £168 million in 2025. So how do we engage? How do we learn from them to engage our federal government to make similar scales of investment, not just in AI, but in this whole data ecosystem landscape? I don't know how they did it, but we can hopefully learn from them.
We have to figure out how to be shinier. To the panel, any reaction to that?
I mean, the UK has a long history of making these very, very large investments. So, I mean, some of it may just be sort of path dependent. But I think, one of the, we've just been part of a collaborative submission to the AI sprint that's going on right now. And one of the things that we really focused on in that submission was that if you want to think about being AI ready and using AI, you have to invest in the underlying data organization, documentation, curation, readiness, as well as the infrastructure, including the federated infrastructure I've been talking about. So there's no AI without good data. Like that's the raw fact of it. So I think it is kind of, but you're right, Grant, it's about trying to make that part of the process look shinier as opposed to what I think it looks like, which is like plumbing or electricity, which we know we all need, but we don't want to think about and we don't love spending money on.
It feels like private businesses are in a better position. They may be partnering with folks at Microsoft or Google, but then I think it was raised earlier, like you bring them into play with a public investment as well, and then you raise all kinds of questions, but it just seems like they're so much further along. And is there a way that we could set up a partnership that still maintained kind of that freedom and the trying to do the public good piece? It just feels dangerous also.
Mike, do you actually have a question, or did Ted just push the mic at you? Okay. Thanks for confusing me, Ted. Okay, so this is kind of the wrap-up question, which we didn't get to for the first panel, but I just asked all the panelists, like, if you were a dictator for a week or a month, or pick your time frame, and then everything was going to go back to the way it was in terms of like political sort of pressures and things, what one change would you make that you would hope would last, post post dictatorship, what would you change? What would you adjust? What's the easy win that you think is sellable? What can we do? What's something we can move forward with? This also invites you to sort of conclude any thoughts that have occurred to you over the course of the discussion. Why don't we start with Laura?
So I feel like I have an easy answer to this because I've had the same answer for 10 years and I've said it in so many rooms and I'm just waiting for someone to do it. So in the Child and Family Services Act, in the collection of data, there is no specification that Child and Family Services can collect the OHIP number when they see families. So just add it. It's that simple. So I'm just going to keep saying that over and over again, because if we did that, then mental health would wrap more closely into health, and it literally just takes a change in the act of like one line. But then I think a broader wrap up from that is around political will. And I know with the Ontario Child Health Study, when we went to meet with ministry folks, they were all very supportive. But it was really hard to get them to articulate questions that we thought we could answer with the data. We went afterwards and said, we really need a mental health monitoring system. And they said, great, we're not going to do anything. And so it just feels like trying to find that window of opportunity to kind of get a political person behind what's happening. And as I mentioned, Stelios Georgiades at Offutt is doing a great job of doing that advocacy work and trying to partner at the policy level. So I'm excited to see where that goes in terms of data strategies.
Okay, thanks. Sylvana or Kim?
I won't be very original, but I think that a common identification number for every sector and every province, every citizen would really, really save a lot of resources trying to match, harmonize data sets. There are many other things, but if I limit to one, it would be that one.
Yeah, I just want to first make it clear that I'm a benevolent dictator, so no one needs to be worried about my short reign. I think that, and this is a really tricky question because I think that there's so many things that need to be done. But I think if I have to boil it down to one thing, I would change data stewardship. I would, first of all, create health data access bodies the way the European Union is going. So we remove what I see as some conflicts of interest and data governance as it exists now, and then really institute principles of data stewardship that frame things around the answer is yes, you can have access to data as long as you meet these criteria, as opposed to the way it is now, which is the answer is no, unless you can jump over these through these hoops and over these various bars to get there.
Okay. Any last questions from the audience? Tess, do you have anything on Zoom? No? Okay. All right. Well, I think lunch has arrived. I'm just kind of peeking out back there. So my understanding from the schedule is that we are back at 1 o'clock with education, social development. And that's it for now. Thanks, everyone.